Okay, today I'm going to demonstrate this specific skill called oral care. This is a skill that you will be able to perform in front of your proctor come the exams on your state skills exam. Okay, now I'm going to begin. I'm going to begin first with my supplies, and I'll introduce them one by one to you. I got a cup of water. There is no water. In the test, it's just air, water. You also have a pair of gloves, one and two. You also have your brush and a toothpaste. Definitely, you also have your kidney basin because they say shaped like a kidney, and also called this Emesis Basin. What is emesis? Vomit. So you have to put this inside here. The bristles up while it's inside here. So that's two objects in there. Also, you have your cloth protector or shirt protector, which is going to be just your wash towel. So when you are set, you tell your proctor, I'm ready to get started. So now what I'll do is my patient, I'm going to be here. And this is the exact words you will say, my friend. You'll go, I already washed my hands. Knock, knock, knock. Good morning, Miss Mary. My name is Fritz, and I'm your CNA today, and I'm here to assist you with your oral care. May I come in? And then your patient says, yes. You go inside. First thing to check is the wristband. I'm going to make sure this is the right person. Checking the wristband, Miss Mary. Hope you had a good day today. It's time for your oral care. That is my patient, Miss Mary. Next thing I'm going to do is I'm going to close the curtain for privacy. Closing the curtain. And then I'm going to make sure that the wheels are locked. The bed is in the lowest position at this point. And then she has access to the call light button. Okay. And then what I'm going to do is I will gather my supplies. Miss Mary, I'll be right back. I'm going to gather my supplies. Your supplies are already available. This is by far the best approach when you are doing your skill. Get your supplies ready before you start any of your skills. And then, Miss Mary, I'm back. Let me raise the bed to my appropriate height, height, working level, appropriate comfortable height, appropriate comfortable level. However you want to say that, but you have to adjust the bed to your most appropriate working height. Okay, and then what you're gonna do next is I will, without my gloves yet, I'll make sure to raise the head of the bed. High Fowlers, 90 degrees. Okay, if your bed doesn't go up that much, you just have to verbalize it. The proctor hears you, you get your points. You will not provide oral care when the resident is lying down or semi-fowler. It has to be high fowler. So you have to familiarize yourself with the bed bed controls. So here, this one says the drawing of the head. That means if you press this button here by the head, it will rise. And then if you put the one at the bottom here, it will low, will go down. At the foot of the bed can also go up and down. Okay. So what I intend to do now is rise the head of the bed to 90 degrees. And behind me, you can see Miss Mary begins to rise. Okay. Hello, Miss Mary. Right. It's time for you to have your oral cares with me. Okay. Is that okay? Then I'm just gonna, this should be about okay. So 90 degrees and put the bed control to the side. Okay, now I'm gonna put on my gloves. All right, Miss Meryl, let's get ready here. Put the gloves on, glove number one, and you also have your glove number two back. At this point, I'm gonna get ready with my cloth protector or my wash towel. My good morning wash towel. Put it there, and other side as well. I want you to clip that behind her shoulder so it doesn't fall off every now and then while we're doing the skill. Next thing we're going to do is it says this on the book, it says there you have to moisten the brush. So the brush, put it here, into the water to moist. Then apply toothpaste. Toothpaste. You don't have to open the toothpaste, just pretend that you have that in there on the tip. Now you can begin oral care. Ms. Mary, could you please close, open your mouth. Okay, you have to lower the mask if she was wearing a mask, and then begin brush the teeth to the side, to the front, to the back of the teeth, up and down. And after maybe 10 seconds, you have to mention, Miss Mary, could you please extend your tongue? And then she extends her tongue. 1, 2, 3. Okay, you have to scrub the tongue of Miss Mary 3 times. 3 times. And then when you're done, put that on the table. So here you can see that. So on the table, you have your toothbrush and your toothpaste. Okay, now it's time for me to ask Miss Mary to rinse her mouth. Hold the Emesis Basin and place it right next to Miss Mary's chin. Then with a cup of water, you go, Miss Mary, can you open your mouth, please? Let's rinse. Go ahead and rinse that. 1. Okay, another 1. Rinse. 2. Number 3, gargle and rinse. Okay, very good. Now put them both back onto the table. Now it's on the table. What I'm going to do next is I will clean the side of the mouth of Miss Mary. So here we go. I'll lift this and wipe the side of the mouth of Miss Mary. Same thing with the other side. Okay, and then I'll put this on the table being used already. Then what I'm going to do next is I'll begin to put away my supplies. So I'll hold the cup and then with one hand, and then I got a toothbrush, the toothpaste, and the Emesis Basin. Look, the way I hold it. You will not put the toothbrush and the toothpaste back into the basin because it got spit, it's got blood, it's got whatever mucus in there. So like that. Then you will just put it on the side. You will say, Miss Mary, I'm going to put away my supplies. You have the call light if you need any help. I will wash, rinse, and dry and put in designated area. Then, still with my gloves on, I will now put away these towels. And again, you will say, all right, I will put this in the designated area, which is the soiled linen basket. Bam. Then I knew that I still have my gloves on, so what I'm going to do is I will remove my gloves. Proper way of removing that. Remember, if you will here, so go there, and then just remove that as well. Then put that away. She's a fighter. And then every time that you remove your gloves, you have to sanitize your hands. Okay, now you're back with Miss Mary. Hi, Miss Mary, we're done now. Can I offer you something to read? Do you want a magazine? Or you want a TV remote so you can watch your favorite TV? All right, so you get extra points. Then the curtains, you want me to keep the curtains closed or open? And by the way, you want your mask back on. So your patient at the facility, your patient at the testing center, there's no mask. I just sport Miss Mary the mask. So that's your call light next to you if you need anything. Now the wheels are locked, the bed is in the lowest position, and do you want the curtains open or closed? It says, I think she said closed, okay. All right, well, Miss Mary, I'm gonna go ahead and wash my hands and document. And that ends your skill.